This is an arthroscopic view inside of a right shoulder. Using the probe, you can see, this is the labrum, a normal looking labrum in the posterior and the superior aspect. As you come around the front, you can see this anterior labral tear, also known as a Bankart lesion. It extends all the way down to the bottom part of the socket. The humeral head or the ball portion is above, the socket is below, and you can see the complete separation of the labrum, which includes the ligaments supporting the shoulder, from the anterior aspect of the glenoid. These labral tears can extend around superiorly sometimes. The next step in the repair would be using this little tissue liberator device to free up any adhesions. You want to mobilize this labrum and the capsule and bring it up where it belongs. It'll often scar down immediately on the glenoid neck. You want to free that up as much as possible. Very important in the repair to do so. This video mainly to show you the pathology. Also going to show you the result. I'm going to skip a lot of the in-between. We use anchors, little suture anchors that are non-metallic, into the edge of the glenoid, and we pass sutures. There's a variety of methods of passing suture through this labrum to repair it back in place. Again, the first step is to mobilize this completely so that you can free this up and repair it. There's a variable amount of anchors. You can see one anchor placed inferiorly, approximately 5 o'clock position on the glenoid. You can see how this securely brings that labrum up right up to the edge where it normally attaches. We've roughened up the glenoid surface as well below this to accommodate healing. You're going to have capsule to bone healing. Ultimately, the first 6 weeks or so, we'll have to protect this post-operatively to allow this to heal back into place. These sutures are fairly strong, but they're not as strong as potentially the patient would be if they do too much activity. Again, completed repair, come around superiorly. You got a couple anchors above and the one below. You can see how this pulls the capsulolabral complex up to the anterior glenoid, and you can see it shuts down any ability of that humeral head to drop into that space and for the shoulder to dislocate.